This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Nermeen Sheikh.
As a growing number of parents raise concerns about vaccinations, we speak now with Mary Holland. She's the mother of a child with regressive autism who she believes was injured by the MMR vaccination. Holland is a research scholar at NYU School of Law and advisor to Health Choice. She's also contributor to the blog Age of Autism and the co-editor of the book Vaccine Epidemic: How Corporate Greed, Bias, Science and Coercive Government Threaten Our Human Rights, Our Health and Our Children. Mary Holland, welcome to Democracy Now! Could you talk about your position on vaccinations?
Yes, absolutely. So all vaccines, like prescription drugs, are considered unavoidably unsafe. They carry known risks and unknown risks. There's no question, and I don't believe Professor Reiss or Dr. Offit would disagree, that death is caused by some vaccines to some children, and severe injury, brain damage in particular. That's indisputable. And for that reason, industry and the medical profession were given by Congress virtually blanket liability protection. So we have now an industry with high profits and exceedingly low litigation risks. I think that should set off some alarm bells for us as it is. I also think that the global standard for ethical medicine today is prior, free, and informed consent. And what Dr. Offit and Professor Reiss are suggesting is that there should be no free consent for vaccination. I think that's a very serious departure from medical ethics, and we have to look at it for what it is. This is not just about tort liability, it's about informed consent.
What about the issue of when a child goes to school who might be infected because they have not had a vaccine, but they then will infect other kids?
Yeah. I think infectious disease is real, Amy. Infectious disease is a serious problem. I think what you do when a kid is sick is the kid stays home from school. You make sure that you have medical leave for parents. You make sure that there's health care for children. And I believe in quarantine. I have no problem with the government in certain circumstances that warrant it saying people must stay home or they even must go to other places. But I absolutely have a problem with the idea that the state can force through criminal and civil sanctions that, or failure to educate children, that they have to take compulsory medical interventions.
Talk about your own personal story, Mary.
Just very briefly, my interest in this as a lawyer and as an advocate stems from my personal experience. I watched a child reverse in their development. That's one of the most horrible things any adult or parent can see. You don't want to see, and it is not normal to see a child lose all speech, lose all sleep, lose all bowel function, lose all eating function. And that's what I lived through with my own son. I'm very fortunate that my son has substantially recovered over the years, but through painful efforts, great expense, and his injury is not categorized anywhere. Doctors don't generally perceive things as vaccine injury, but there is no other plausible explanation for what happened to my child.
What happened?
So there was a temporal association. He had received his standard vaccines, most of which contained thimerosal. So that's mercury, ethyl mercury. There's no question that can compromise the immune system. And then he received the MMR vaccine, which is 3 live viruses simultaneously, and he, within a very short period, regressed precipitously. Precipitous regression.
At the age of?
2.5. He got his vaccine slightly before that juncture. It's the only plausible explanation for what happened to him. He had EEGs that were abnormal. He had epileptiform brainwaves. This was all in very close temporal association. So then when I studied what does brain injury look like, and I studied the federally funded Vaccine Injury Compensation Program, lo and behold, encephalopathy, brain swelling, brain damage is a common side effect among side effects from vaccines, as is autism. That is covered up. The federal government doesn't track it. They would say that there's no association. If you look at compensated cases of brain injury in the Vaccine Injury Compensation Program, you will see autism left, right, and center. So I think what happened to my son is what I've heard happen to thousands of parents. I work in this area. It's not an atypical story. One story is an anecdote. What then should happen is there should be rigorous science. That science hasn't been done.
Why do you think that science hasn't been done?
I think that's a great question. I think that's a question I'd love to hear you put to Dr. Offit. He would say that that science has been done. One of the key scientists in the autism vaccine science is Paul Thorsen. He's an indicted felon. He's in Denmark. The Department of Justice has done nothing to bring that man back. Another key question about the corruption is Dr. William Thompson in the CDC has come forward and said that he colluded with other key scientists to mask a signal that vaccines and autism are linked in African-American boys who got the MMR before age 5. He's now been granted, according to one report, immunity and can testify in Congress. I hope to God we have that hearing. This is critical. 1 in 68 kids has autism. There's plausible science that there's a link. It needs to be followed up, not suppressed.
What is the most convincing scientific study to you that makes a link?
There's many in my book. We include 20 scientific abstracts. One is Ray Palmer's work showing environmental mercury. The closer somebody lives to the environmental source, the higher the rates of autism. Another is related to special education reports. Boys, neonates who receive the Hep B vaccine were 9 times more likely to end up in special education, 3 times more likely to have an autism diagnosis. There are many pieces of science that suggest to us that there is a link. We need to look at the children who regressed. We need to look at the crash reports, the people in the vaccine injury compensation program. Just last year, in 2014, a child was compensated $500,000 because she died after getting the MMR. This is not controversial.
So what should happen with the crisis of measles outbreak right now in this country? Are you opposed to children getting the MMR vaccine?
No, I'm pro-choice, Amy. I'm not anti-vaccine. That label's thrown around as a way to marginalize people like me. I'm not anti-vaccine in the slightest. I'm pro-choice. I think parents have to make informed choices. That's the standard of ethical medicine. So what should happen right now? Yeah, look at your titers. See if you need a measles vaccine if you think you should. I think industry should make measles, mumps, and rubella available separately. If somebody has a low titer for measles, why should they go get an MMR? They should get what they precisely need. I think people with young children who are too young to be vaccinated because the risks of injury are so great, they probably should go to places like Disneyland where there will be people from foreign countries where measles is endemic. We don't have herd immunity for measles. We don't have herd immunity for any of these childhood diseases.
And again, explain what you mean by herd immunity.
What I mean by that, herd immunity means that everybody is, that because most people vaccinated, it's not possible that the disease will spread. That's just not possible when something like measles is in the Philippines, it's in Germany, it's in France. People come and go. Unless you're going to seal the borders, we don't have herd immunity. And no vaccine is perfectly effective. There may be 85 to 95% effective. They wear off over time. That's why there's a mandated MMR booster. We don't have herd immunity. We have herd effect. So people have to make up their own minds. And voluntary choices, like in Australia, like in the UK, like in Japan, like in Sweden, like in France, like in Germany, they achieve the same results as we have. We would be so much better. There is not mandates for school. In none of those countries are there mandates. In most of those countries, there are blanket rights of conscientious objection. We should have the same thing. There should be a right of exemption that is federal in this country.
So this has entered into the presidential debate,
Yes.
possible presidential candidates. Chris Christie, ironically, the governor of New Jersey, who said that the medical professional who came back from Africa, who was Ebola-free, should be quarantined, then said he's had to walk back these comments about parents having choice around vaccine. Then you have Kentucky Senator and Dr. Rand Paul making the point you do. He says that kids who have had vaccines have then had mental disorders.
Well, I didn't use the term mental disorder. He did. But this is not my opinion, Amy. If you look at the Vaccine Injury Compensation Program, people have been compensated by Health and Human Services with their Council Department of Justice for brain damage, for encephalopathy. Encephalopathy is cognitive impairment usually associated with behavioral disorders, okay? So I think it's great that this is a 2016 presidential issue. I think that childhood health is critical. I think the role of vaccines is grossly understudied, and we must look at this. Chronic health disorders are about 50% of American kids today. Is there a relationship with vaccines? I don't think we know the answer to that. We don't even have a decent study of vaccinated versus unvaccinated health outcomes in children.
What do you mean?
Rudimentary science. We have not looked either retrospectively or prospectively at what is the health of children who've gotten the CDC recommended schedule? What is the health of children who've gotten a state mandates, and what is the status of children who are unvaccinated? That's a totally doable study, and that's never been done.
Your response to those who call you and the people, the organizations you're a part of, anti-vaxxers, sort of see you as kind of climate change deniers, that the overwhelming scientific body of evidence goes in the other direction, and that the time when a child is getting these vaccines is also the time if they might develop autism. And so the fact that these are, contemporaneous does not mean that one causes the other.
Amy, I agree that, correlation is not causation. We have to study this. I couldn't agree more. But in the 1980s, that's a mere 30-plus years ago, the rate of autism was 1 in 10,000. It's now, according to the CDC, 1 in 68. And that's looking at 8-year-olds, and it's 4 years to do the study. We don't even know what the rate is among 2-year-olds today. To say out of hand that vaccines could be playing no role, in my view, is reckless and irresponsible, and it's not looking at the existing science. In our book, we include 20 abstracts. There's far more. There's good science that shows how plausible a connection is, but it needs more rigorous study.
Could you talk about, you've mentioned this, the importance of the schedule of vaccines. So it's not so much that certain vaccines necessarily not be given at all, but that they be spaced differently.
Yeah, I mean, there's not a lot of rigorous science showing why the schedule is what it is. The way that vaccines are tested before they're recommended and then mandated is they're tested individually. They're not tested as part of a schedule. As Senator Rand Paul said, he criticized the recommendation and the mandate in most states for a hepatitis B shot for infants, 1 and 2 days old. Hepatitis B is sexually transmitted. What is the rationality for giving a baby a vaccine that will wear off by the time they're sexually active?
What do you mean by the single doses rather than MMR, M, then M, then
Well, MMR
R?
is measles, mumps, rubella. But while a baby is in the hospital, the federal recommendation is that they receive a hepatitis B vaccine. That, to me, is irrational. And that's one example of what's wrong with our vaccine schedule. Again, many other developed countries have no mandates for hepatitis B. It's something you give to somebody whose mother is Hep B positive or somebody who's engaging in very risky behaviors where there might be transmission.
I want to get your comment on President Obama, who has said his message to parents was, quote, get your kids vaccinated.
Measles is preventable. I understand that there are families that in some cases are concerned about the effect of vaccinations. The science is, pretty indisputable. We've looked at this again and again. There is every reason to get vaccinated. There aren't reasons to not get vaccinated.
Are you telling parents you should get your kids vaccinated?
You should get your kids vaccinated. It's good for them, but we should be able to get back to the point where measles effectively is not existing in this country.
Mary Holland, what's your response to President Obama?
I think it's extraordinary that we need the president to tell parents to get their children vaccinated. I think that if you look at it in isolation, yes, the vaccine usually works against measles. Are there risks with the vaccine? Yes, there are. And should we look at that in isolation? No.
Are you getting your kid vaccinated?
My child has been vaccinated with the MMR, obviously. He suffered developmental regression shortly thereafter.
But for other parents, would you say do or don't?
I would say it's up to them and their doctors and their healthcare practitioners. I think it's an individual choice.
Mary Holland, we want to thank you for being with us, research scholar at NYU School of Law, advisor to Health Choice, a contributor to the blog Age of Autism. She's co-editor of the book Vaccine Epidemic, How Corporate Greed, Bias Science, and Coercive Government Threaten Our Human Rights, Our Health, and Our Children. And she is the mother of a child with autism who she believes was injured by the MMR vaccine. This is Democracy Now!, democracynow.org, the War and Peace Report. When we come back, we'll be joined by Dr. Paul Offit, professor at University of Pennsylvania, author of, among other books, Deadly Choices, How the Anti-Vaccine Movement Threatens Us All. Stay with us.